Let me ask you something strange. Doctors save lives. Patients risk everything. So why the richest people in healthcare, not doctors, not nurses, not patients, how did people who never touch a patient end up owning American medicine? This is not conspiracy, it's not political, it's structural. And once you see it, you cannot unsee it. Let me start with a big lie. Most Americans think healthcare is broken because long waits, high bills, burned out doctors, angry patient. But here is the uncomfortable truth. Healthcare is not broken. It's working exactly as it was redesigned to work, just not for you. This is the shift that changed everything. Medicine used to be a profession. Somewhere along the way, it became an industry. So when corporations realized something powerful, that controlling access was more profitable than improving outcomes, everything changed. They learned how to monetize access, own infrastructure, control data, avoid the clinical responsibility. Healing stopped being the product, control was. The key is monetizing the middle. The most profitable position in healthcare is not at the bedside. It's the middle. Example, insurance companies, PBM, the pharmacy benefit manager, prior authorization companies, hospital administration layers. They don't deliver care. They charge for permission to deliver care. Imagine if airplanes charge pilots every time they wanted to land the plane. But who writes the rules? This is the shocking. Doctors don't write the rules of medicine anymore. Non-doctors control billing codes, documentation requirements, quality metrics. So if the exam room become secondary and the spreadsheet become sacred. And here comes the weapon they use, complexity. Healthcare is not complex by accident. Complexity prevents competition, exhausts physicians, confuses patients. If the system were simple, doctors would regain leverage. So how about the risk and profit? You will see it's completely opposite. Risk flows down, profit flows up. In healthcare, risk flows downward. Doctors absorb malpractice, emotional trauma, clinical liability. Patients absorb denial, delays, financial toxicity. Corporations absorb almost none. The huge opportunity is created, and it's buying medicine at its lowest point. Burnout created opportunity. Private equity waited until autonomy collapsed, reimbursement dropped, debt exploded. Then they bought medical practice cheaply. Doctors become employees inside their own profession. So what happened after automating extraction? Algorithm replace judgment. Metrics replace medicine. Volume replace value. So patients become data points, risk scores, utilization curves. Care become throughput. Let's go through the missing truth one by one. Data ownership. 1. Doctors generate the data. Patient creates the data. Corporation owns the data. Doctors type it for free. Others sell it. Regulatory capture. Regulation now protects infrastructure, not people. 3. Value-based care illusion. It sounds noble. In reality, risk dumped on doctors. Metrics gamed. Paperwork exploded. Downside risk without upside control. 4. Vertical integration trap. One corporation owns the insurance, the pharmacy, the clinic, and the data. Competition disappears legally. 5. Student debt as control. Doctors began practice already trapped. 400,000 K in debt. No business training, of course. Delayed earnings. That enforces obedience. Come the language control. We don't control doctor anymore. We call them provider. Patient, they are consumer. Care, they are throughput. Language did not change by accident. 7. Antitrust asymmetry. Hospitals merge approved. Insurance merge approved. Doctor unite blocked. Market apply only downward. 8. Moral injury. Doctors are not burned out. They are morally injured, forced to deny care they know is right. 9. The patient is the product. Patients are not customers. They are data, risk, revenue streams. Care is incidental. So what comes next? Let's go with some hope here. The system will collapse unless power realigns. The future requires physician ownership, patient-doctor alignment, data ownership reform, administrative reduction, corporative care models. Medicine was never meant to be an empire. It was meant to be a covenant. If doctors and patient don't stand together, someone else will always stand between us. And that's exactly how we got here. This is Dr. Ben Mommer. Follow to build momentum to fix healthcare in America.